Welcome. Mrs. Lewis and I are going to demonstrate a head-to-toe assessment for your class. And this is kind of just to give you an example of what a quick head-to-toe, maybe 10 to 15-minute assessment could look like. Remember, you know the skills of in-depth focused assessments. If something is abnormal, you would go more in-depth if you needed. Let's say I am in 150, my resident already got bathed, went to breakfast, came back, and I say, hey, would you mind if I take you back to your room and do a quick head-to-toe assessment? Just listen to your heart, your lungs, ask you a couple questions. Is that okay with you?
Yeah.
Great, let's take you back to the room. I'm gonna wash my hands. I'm gonna have my card in my pocket. It's nice and wipeable so it's safe and clean. And I am going to get started. Remember me from earlier, I'm Miss Tucker, I'm your student nurse from HAC. And can you tell me your first and last name?
Holly Lewis,
Oh, I mind if I just check your again. And what is your date of birth?
1/13/76.
Wonderful. I'm gonna ask some silly questions. What year is it right now?
It is 2020.
Wonderful. And who's the president?
It is President Trump.
Good. And what was the last holiday we just celebrated?
New Year's.
New Year's. Very good. Very good. And do you know where we are?
We are at HAC's Sim Lab in the Lancaster campus.
Very good. And why are we here today? Or maybe what brought you into this facility?
We are trying to help the students learn how to do a quick, nice, concise assessment.
Okay, wonderful. Thank you so much. Now you'll realize I've already on my head-to-toe assessment card, I've checked her neuro. She's awake, so she's not slumped over, she's not lethargic. She's awake, alert, and oriented times 4. Her speech was very clear. I heard no garbling, no garbled speech. She's speaking English. She's oriented to personalized time, speech is not rambling, all these great things. I've already kind of done a quick look over her. She is well groomed. Her posture is straight, so that's going to be over on our musculoskeletal here. Again, there's lots of things you guys are seeing with your patients right away that you can write down into your assessment worksheet. Okay, now I'm going to get started. I'm going to get my pen light out that I always have on my badge at work. I'm just going to shine a quick light. Your eyes just look at my forehead. Shine a quick light in your eyes. Wow, her pupils are equal, round, and reactive to light. Now the A is accommodation, I've not done that yet, so her pupils equal, round, reactive to light. I'm gonna take notice to what size her pupils are. On your pen light, you have that little circle to compare. She's about 2 millimeters, so I'm gonna write down 2 millimeters on my assessment sheet. I will check for accommodation very quickly, so can you look at that wall, the far wall? I'm gonna bring my pen light right up to your eyes. Don't focus on the pen yet, I'm just gonna get it right here. Now focus on my pen. Now I'm watching her pupils constrict as they accommodate for distance. So she was looking far away, now she's looking close to my pen. And I only could look at one eye at a time, so I'm gonna look at the other one. Look at the far wall again. I'm gonna bring my pen up. Now look at my pen. Excellent. So I see her eyes accommodating for light. So that is checked off my list. I'm just gonna do a quick, Nora, can you shrug your shoulders for me? Smile, frown, stick out your tongue. Woo, everything looks great. Squeeze my hands. Squeeze them as hard as you can. Very good. That feels nice and strong on both sides. Can you just push against my arms with your legs? All right, great. Her strike feels equal on both sides, and that's something I'm taking notice of. Again, I'm not doing a full 12 cranial nerve assessment unless I notice something abnormal. She can hear me speaking. Can you hear me talking right now?
Yes.
Okay, very good. I'm glad to know that. Okay, I've kind of talked in a lower tone. She's heard me. I'm not going to worry about that. Do you wear hearing aids at all?
I do not.
You do not. Okay, so if she did, I would know which ear she has a hearing aid in. Sensation. Do you have any numbness or tingling anywhere?
I do not.
Okay, wonderful. And you can feel me touching you here. So feel sharp jaw. You can feel me touching your feet. Okay, again, diabetics might have some neuropathy. I usually ask, and then I do kind of feel and touch. If they have no numbness or tingling, I do not go in depth with that. Very good. Oh, and do you wear contacts or glasses?
I wear glasses.
Oh, do you wear glasses for distance or for reading?
For both.
Wonderful, okay. And do you have them with you?
No, I left them at home.
But I would take note of that too, that she does wear glasses and is both for distance and for reading. Wonderful, and if I did want to check her vision, I could quickly say, hey, can you look at the clock up there on the wall? What time does that read? There's not really a clock there. Exactly, great, so you can see that, that's wonderful. Okay. So far, you guys are gonna, again, this yellow card's gonna be your guide. So I think I've covered everything. Her eyes, I don't notice any drainage. If she did have any red drainage, yellow, clear, I would note that. But I'm moving on because I don't see anything. She can hear me and her ears are not leaking any. I see no, if I saw cerumen in her ears, like I would note that. All right, musculoskeletal. I've already had her squeeze my hands. I've noticed she can move her arms. Can you just put your arms out straight for me? Push up, push down. Put your arms up above your head. Do you have any surgeries on your knees or hips? Are there any parts of your body you can't move well? Again, your patients in the nursing home might have some issues. And when I get her up to toilet her, when I already saw her get out of bed to go to breakfast, I probably saw her ambulate and I took note of what her gait was. I'm not gonna sit if I've already seen it and do it again just to have it be part of my assessment. If I've seen her walk, I know what she looks like. I'm gonna note whether she was slumped or had a straight posture, and whether she looked steady, or if she looked like she was unsteady, and how well she used her assistive device. Does she need some training or does she not? Musculoskeletal, straighten up. And again, I'm just noting, any swelling in her knees, does one ankle or foot or wrist or knee look swollen? She's looking pretty good. Her upper body strength, we've already checked. We've had her push against the side. Again, if she's had a history of a stroke, I might check if one side's flaccid, I would see how much limited range of motion she has. You would want to note if someone's contracted, if they've had a prior stroke, if maybe one arm is, has limited range of motion. Moving along, guys. Let's see. Now, under extremities, similar to the circulatory, you're gonna see an area that says inspection and then heat and edema. That would be part for if it was like a joint issue, musculoskeletal issue. Swelling in more of the joints is what we're thinking, and then we'll get into circulatory for like peripheral swelling. But I would also take note of that. So if you have someone who's got a really swollen knee or an elbow, take note of that and write that down in your assessment. So we're moving on now to our circulatory. And I'm gonna assume that you have also already taken their vital signs. So, we've already taken our vital signs. So within your circulatory assessment, I'm gonna expect to see what their temperature was and what route you took it. I'm gonna look at her skin, and again, I might quickly just feel. What's important here is, if someone's extremely hypotensive, they can be diaphoretic and sweaty and cool to touch. Well, I'm just making sure that her skin is warm to touch on both sides, that it's equal on both sides, okay? She does not look flushed. She doesn't look pale. She doesn't look like she's being diaphoretic. All right, of course, capillary refill. I'm gonna push down. Nail beds, if they are wearing nail polish, you do the beds of the finger pads. You just push down, let it go. Make sure it's less than 3 seconds. 2, 4, she is about 2 seconds, she's good. I'm gonna do it on her feet as well. And if I was really going in there with the toes, I would put some gloves on. So I'm gonna push her toes. Again, we're not gonna demonstrate, you guys know how to do these skills. So I'm pushing on the nail bed of her toe, I'm letting go, it's coming back. Again, if her toes, I'm gonna note if their nails are thick and yellow, if they don't look appropriate. If so, I'm gonna do the tips of their toes. Okay, wonderful. Gonna listen to her apical. You've already checked her pulse and her blood pressure, and you're gonna note that in your circulatory assessment. You're gonna listen to her apical. Now remember, there's 2 things you're assessing with apical. You're gonna listen to it and find out if it's regular. There's not really a thing of strong. They say sometimes they write strong. It's more if it's regular and what the number is. So it's 70 beats per minute if it's regular. I'm also then listening for any abnormal sounds. I'm listening for swishing for a murmur. I'm listening for clicks of a aortic, a valve replacement. Anything else that could be abnormal, you should just hear the lub-dub, lub-dub. And then the rate, sometimes if it's hard to hear distant, if you guys get in there, you've got an elderly patient, maybe they have AFib and it's an irregular heartbeat. If you listen and you have trouble hearing it, maybe it's got loud vowel sounds, lung sounds, I cheat and I feel a radial while I'm listening to hone in on that sound. So as I'm listening to the sound and I finally kind of close my eyes and get honed in on the sound of that heart beat, and I get, oh, that's that nice low tone, okay, I feel it with my finger and I hear it, then I take my finger away and I would count my apical, okay? But sometimes you might need that little cheat of a radial just to get you honed in. So I've checked her rate, it's 70. Apical's regular. Blood pressure we already checked, 120/80, she's perfect. Pulse, we checked apically, but now we also need to do peripheral pulses. Am I gonna check every cotton pick and pulse? I'm not. I am gonna do the most distal, so I'm gonna check her radials at the same time, because I wanna feel if they're equal. That's an important assessment. Are they equal? Are they regular, irregular? They're regular. And are they strong or weak or moderate? You know, the +1, +2, +3, +4 of how the strength of it. I'm not gonna do all the other ones. If I feel it here, I'm pretty sure she's got circulation to there. If you had an amputation though, if there was a reason, if she was missing, you know, a BK or an AK, you know, I might need to go for a femoral or a popliteal. But then I always do my pedals, okay? And now I'm feeling her pedal bosses. Are they equal? Are they regular? Are they strong? Or are they weak? And they are strong and equal bilaterally, okay? Strong, equal, and regular bilaterally. What have I missed so far, guys? The skin, the color of the turgor, we gotta do turgor. I'm gonna pinch her hand because she's nice and young and healthy. If it's an elderly person that maybe has a little more non-elastic or a little extra skin, we might check right under their neck. So she has either elastic or non-elastic skin turgor or tenting. Peripheral pulses, we check again, just the most distal. If you wanna practice some other sites, by all means practice. But just for me, I'm happy at least if you do the radials and pedals and write it up on your assessment sheet. What's that?
As long as everything's normal.
As long as it's all normal. If it's not normal, you wanna investigate. And again, the color, I've already know the color of her skin. She's pink, she's, you know, the proper ethnicity. It doesn't look like it's purple or discolored or dusky as if there could be a circulatory issue. Okay, but if I see that, I wanna investigate, and it would probably be cool to touch if it's got some abnormal color.
Temperature goes there.
Oh, yep, temperature goes under the route and the location, I think under here, we also talked about IVs, so maybe gonna be less common in the long-term care setting, but once you get to 151 and you're in the hospital setting, where's the IV site, where's it located? So left forearm, left AC, and then what size is it? Is it 20 gauge, 18 gauge? You'll get into that, don't stress. And then is it a peripheral site or is it a PICC line? Like, you know, sometimes you might have a site coming out here, but it's actually a central line. It's actually the tip of the catheter is up, centrally located. So do take note of that. Where is it? What sort? And then is it running anything or fluids infusing? And if so, what is it? How fast is it going? You guys probably are not worrying about that yet. So I think I've covered everything on this card. I'm gonna move on to my respiratory assessment. Now I'll tell you, in real life, when I'm assessing, once I got my stethoscope out, I do it all. I know I'm kind of going in order of these things, but if I've been over here and I've engaged my patient, I don't go back and forth and, you know, well, listen to the heart, I say, oh, just breathe regularly, I'm gonna listen to your heart. And then after I've listened to the heart, I've made sure it's regular, I've maybe counted it, then I say, okay, now take a couple deep breaths. And I listen in all my lobes with a couple deep breaths, right? I'd be under her clothing, you would be maybe under the skin. You can always do one of these under the shirts and put it skin to skin and keep them dressed. You don't need to get them completely naked. And then I usually give them a break because I don't usually do anterior and then posterior because I want them to rest and I want them to get hyperventilated. So I actually listen to the lung sounds anteriorly first, give them a break, and I head down to their belly. And I say, have you had any nausea, any issues stomach-wise? Did you eat your breakfast this morning? Did you eat all of it? So I'm checking 100%, all that stuff. Again, I've gone into GI, but this is just how I would actually do it. And then I do her belly, just going right down. But let's go back to respiratory. I listen to her lung sounds anteriorly in all lobes, and then I'm gonna listen posteriorly after I've done the GI. But I would listen, and I would listen for anything abnormal, and if I say her lungs are clear in all lobes, they would have to be clear anteriorly, posteriorly, and laterally, okay? So I've listened to all my spots, and clear in 5 legs. I'm also gonna say, have you had any shortness of breath lately?
No.
No shortness of breath. Any cough? Do you cough ever?
No.
Okay, if she had said yes, I'm gonna say, oh, when you cough, do you cough something up? So is it productive or non-productive? If she says yes, I cough stuff up, I'm gonna then go into my more further questioning about the sputum. What color, how often, the consistency, does it have an odor? Set color. Under respiratory, we're of course getting her O2 saturation, and I'm gonna note it, I'm gonna check her O2 sats. I'm doing her vitals. 99% on room air. Always say if they're on room air or oxygen. Can't just assume. And if she is on oxygen, how many liters? All right. And the respiratory, it's not a regular rate. The rate is gonna be a number. So her respiratory rate is 12, or her respiratory rate is 20 reps per minute. Rhythm, is it regular? Is she doing some chain stokes? Is she like going fast and slow? And that's not gonna be because she's talking or eating, it's gonna be her just at rest. Is she regular rhythm? And then the quality, is it very deep, or is it very shallow, or is it just normal quality? It's not really normal, it's not shallow, not deep. Okay. Is she having a retracting? Is she short of breath? Those COPDers might be like using accessory muscles, you know, so really look at, does she look comfortable and calm while she's breathing? All right, anything I missed there? All right, guys, now we're gonna go on to the GI. I already asked her what she ate for breakfast, how much she ate, if she had any nausea, any vomiting, any issues. I would also take note of what type of diet is she on. Is she on a thick and liquid? Is she on a regular diet, diabetic, carb controlled, you know, low sodium for a cardiac diet? What is her height and weight? What is her general, like, is it one of these really frail, skinny, like a cachectic patient looks like she hasn't eaten in a while? You know, what is her general? Percentage eaten, oral cavity, can I see your teeth? This is where you want to check. Do they have dentures? They upper, lower dentures? Any problem chewing? I just take a peek in your mouth. I would shine my little pen line in there. It's a really nice pen line. I might look for any discoloration in the teeth, you know, any cavities. You could talk about missing teeth. Sometimes students write like missing some teeth. Great, so I did that. Mucous membranes, are they moist? Is it proper color? Do look at the tongue for thrush. You know, they could have an infection, that sort of thing. Let's get here. So appetite, diet, nausea, vomiting, height, weight, mucosa, swallowing. Any problem swallowing? Great. If she does, I would say, you know, history of aspiration, teeth, and then condition. All right, so the abdomen, I like to remember it as look, listen, feel, because you always want to look at the abdomen first. You listen before you palpate, because if you start to palpate, you could start those vowel sounds. So I'm gonna look for any distension, any hernia sticking out. Then I would listen to all 4 quadrants. I always start in the right upper. Do we have to do that? Anyway, we listen to all 4. You're gonna listen. Once you hear a few go, you don't need to listen for a full 5 minutes. If you're listening and hear nothing, that's when you would listen for a long time to see if it's hypo or absent. 5 minutes, nothing to be absent. But I'm gonna listen. I'm gonna say active in all 4 quadrants, and normoactive, not just active, normoactive, all 4 quadrants, and then I might palpate and say, do you have any pain when I push? Any pain here? Any pain? I do light palpation. I might do some deep palpation. Do I feel any lumps, bumps, any masses, anything like that? And I check for pain. I watch her face to make sure she's not feeling any pain. So I've looked, I've listened, and I've felt, and a proper abdominal assessment written up would look like abdomen was soft, non-tender, non-distended, normoactive bowel sounds in all 4 quadrants. Bam, you would knock it out of the park if you did that. Let's just see if I missed anything. Ooh, soft and tender. And again, if she has any pain, you have to say what quadrant. If you feel any masses, you're gonna talk about what you feel. And then bowels, I wanna know when her last bowel movement was, the consistency. So, you know, like last bowel movement, when the date was. What's her normal pattern? If she just moved her bowels 2 days ago, is that normal for her? Or does she normally go twice a day? No, I think she might be constipated. And then I might say, was it diarrhea or constipation? You know, the last bowel movement. And hopefully you get to toilet them and you'll get to see the color and the consistency. We're not necessarily gonna know until we see. And then do they use laxatives or anything to help them go each day? All right. Again, we're gonna write this down. Colored all that and colored. And this would be the place where you would document if someone has a colostomy or a stoma. Where's the location? What does the stoma look like? What color is it? Should be beefy red, healthy, not black and necrotic. All right, guys, we're working through our boards pretty well now. Again, this yellow card should be your buddy. And I don't know, this tall board might not work here. Can you see it? This tall one might just fall right down. Last one, your urinary, GU. Just gonna do a quick check of the camera. Oh, I figured it was not gonna be on there. Okay. When you toilet your patient, you will get to see their urine. If they're incontinent, you can still at least look at the brief and see what color. Is there an odor? Is there a strong odor? A foul smelling. How often do they go? Did they void? Did they not void? When was the last time they went? Eyes and nose would be what was their intake at breakfast and lunch while you were there? How many times, how many wet briefs? Was it saturated? Was it just a little bit? And if they're going in the toilet, hopefully, we might be measuring in the hospital, you would definitely measure, maybe in the long-term care they may not, but at least how many times did they go? And then when you help them to the bathroom, this is your chance to maybe peek at their peri area. So, are you having any rashes? Do you have any red or burning in your peri area? Any discharge? Any odor? Always ask, especially for males, any difficulty starting your stream of urine, any burning sensation when you go. Okay, those are important questions to ask.
And look at the urine. Is it yellow?
Yes, looking at the urine. So if they have gone in a Foley bag, a leg bag, we're collecting it. What color is it? Is it, definitely the color, so for hydration status, clear or cloudy? Any sediment? Is there any blood? Any mucus? And then definitely the odor. All right, so you have almost done all of your physical assessment at this point. Oh, yes, skin is very important. So, most of your long-term care residents, if they have a dressing, hopefully it's known, but oftentimes we or you as students will be finding an open area. So think about all the bony prominences that would be your biggest concern. So when you're toileting them, look at their sacral area, look at their peri area for any open excoriation, skin tears, bruises. You're going to take note of anything you see and document very, do we have skin? Very specifically, size, measurements. Think that is falling under your psychosocial, and then below that was additional data. Your pain, your wounds and incisions, and your drains and tubes. So make sure we're doing skin, location, color, size, and then what dressing, if anything. If you notice some excoriation, make sure you document that you applied barrier cream, as a preventative measure. And then psychosocial, you're gonna do that all day while you're there on shift. You don't have to cram it into your one quick little assessment time, but how, is the patient, what sort of mood do they seem to be in? Are they anxious? Are they sad? Are they teary? Use objective. You don't want to say, oh, the patient seemed angry. What made you think that? That's a opinion. Patient raised their voice. Patient stated, you can put in quotes what they said. If someone appears anxious to you, what are the behaviors they're doing? Pressured speech, yelling, rocking, screaming. What are the objective behaviors that are happening? Crying, yes, teary. Patient was, tearful while stating X, Y, Z. Talk to them. Who are their support systems? Do they have family that come to visit them? What culture are they coming from? Were they raised on a farm where they have a certain work ethic? Were they someone that went overseas and, for religious reasons and was, missionary? Were they a missionary? Did they come from a high socioeconomic status? Did they come from a low socioeconomic status? All these things encompass culture. Yes, race and ethnicity is one, but the way we were growing up, what we surrounded ourselves growing up is a culture itself. And then think about spiritual, you can ask, do they have spiritual beliefs? Sometimes when we get at that point in their life, what do they find that comforts them spiritually? Maybe not religious, but. And then Erikson's and Maslow's, keep those in mind. What level at Erikson's and what side, generative versus.
Ego integrity versus despair.
That one, despair, that's it. And then Maslow's hierarchy of needs. Excellent. So hopefully this helps you. If you guys have any questions, please let us know. This is a work in progress. We're happy to do some additional videos if needed. Using these cards, I can't stress enough, use these cards to use your terms. Make sure you're looking them up and you're using these cards. Write up your assessment so your clinical instructors can give you some feedback to how you're doing.
Do you want to just show them a whole,
like a quick
pretend to do it without explanation?
All right. Let's do a second
Do not
video.
buy that.
Do you want it?